So hi, everybody. Today we are thrilled to have Dr. Denise Jagroo join us again. Today's topic is pelvic health and rehabilitation, part 2. Dr. Jagroo is a board-certified clinical specialist in women's health physical therapy. Dr. Jagroo has been a pelvic rehab specialist for over 2 decades and has worked with a wide range of patients, including cancer survivors. So today she's returning to continue to teach us about pelvic health, how to find and strengthen your pelvic floor muscles, and how cancer treatment may affect sexual functioning. So thank you so much. I am going to share those slides, and we are thrilled to have you today.
Okay. Yes. Wonderful. Oh, it still says January. Sorry. Again, I'm Denise. Thank you so much for having me back. I'm honored to do this every year, and I'm so happy to do a part 2 because last time I know I threw a lot at you, and we didn't get time to like do some exercises at the end, and it was really a lot of like dense information. So I was focusing today on more like tight pelvic floor muscles and like sexual functioning, and then we'll be able to do some exercise, and I'll have time for questions and answers at the end. Yeah, you can go to the next slide.
As I'm screen sharing, I can't see if anybody's joining the waiting room,
Okay.
I think.
Mm-hmm.
So could you just keep an eye out for that, or I can ask Carly to do that also, because I can't.
Yeah, you can make me a co-host and
Perfect, because I just can't see that part with sharing the slides in that manner. Okay, perfect.
Sure. Perfect. Okay. So this is going to be review from the last time, just to reintroduce pelvic floor is layers and layers of muscles at the base of the pelvis. So don't worry about the names. They're so long and descriptive, but like just know that there are many, many layers and they have several functions. So let's look at where they are. If you're looking at the left side of the screen, that's the front of the body, front of the pelvis, right? And the back where it says the spine, obviously that's the back of the pelvis. So in the middle, you have your pelvic organs. So the pelvic organs that we'll be referring to today are the bladder, that's the yellow circle, the uterus, and the bowel. So the pelvic floor muscles are at the bottom of that. It's like a sling and it's layers and layers of muscle. They all work as a unit. They all work at the same time. And they have very, very important functions. So think of it as like a supportive sling or like a hammock, like underneath the pelvic organs, and they're supporting the pelvic organs. You can go to the next slide. Mhm. Oh, this is a video. I'm not sure if it'll work if you can hit play. Audio? Is there audio?
Your core.
Oh.
These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back and from side to side. They support the bladder, bowel and uterus, and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around your vagina, as if you are trying to stop the flow of urine. Lift them up inside. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice as you tighten and lift your pelvic floor muscles, they tighten and close around the anal passage, vagina, and urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
Okay, next slide. So an important point I want to make about that is these are muscles that you can identify by trying to stop your pee. So if you're on the toilet and you want to find the muscles and you want to just kind of try to stop your flow of urine to identify and find the muscles to try to build awareness, that's okay. But don't get into the habit of exercising your muscles that way by constantly stopping your pee, because that's sending the wrong message up to your brain. Whenever you want to urinate, your sphincters have to relax, your muscles have to relax, right? So if you're constantly stopping your pee, then you're sending the signal that's the opposite of what you're trying to do, right? So you're like tightening your muscles during urination, and you don't want to do that. Also, if you're always stopping your flow of urine, there's always a residual, right? Because you're not letting the bladder empty fully, and you don't want to get in the habit of doing that because it can lead to a UTI. It can build up the toxicity in the wall of the bladder, and you want to do that. You want to fully empty, so you don't want to keep like contracting while you're peeing. But again, if you just want to identify the muscles, that's a good way to do it. So in this picture, it's just showing like the orientation of the muscles, right? If you were laying down, it would be at the base of the pelvis. And if you were looking at your pelvis kind of like as a clock, and the top is 12 o'clock and the bottom is 6 o'clock, your rectum is at 6 o'clock, your bladder is at 12 o'clock, and right in the middle is the uterus and the vaginal canal. Okay, you can go to the next slide. Okay, so what are the functions of the pelvic floor? There are 5 functions. Okay, that we call it the 5 S's. So one is sphincteric, meaning that it is supposed to hold in your urine and hold in stool, right? If you are leaking urine, even 1 drop of urine, you are incontinent. It means that your muscles are weak. Also, if you leak gas, right? If you toot when you cough, right? Or if you leak a little bit of stool, then you are fecally incontinent. So these muscles are supposed to reflexively close off the bladder and the rectum when you cough, laugh, sneeze, when you lift something. It should always be closed off until you are on the toilet and you are ready to eliminate the contents of your pelvic organs, right? So they should be able to hold in those contents, and you shouldn't have to think about that. It should be reflexive. Okay. The other is a sump pump, meaning it pumps like excess fluid from the pelvis out, like the lymph fluid, the fluid in between the cells, pumps it out so there's no buildup of fluid in the pelvis. Support, these muscles attach to your pelvic wall, to your pelvic bones, and they support the pelvis. So there's 3 bones in the pelvis, right? You've got the bones on the side, because it's like a bowl, right? So it's bones on the side called your ilium, and then you got your sacrum in the back. Attached to the sacrum is your little tailbone. So there's technically 4 bones, but it supports the bones and it supports the pelvic organs from underneath. Stability, it's the same thing. It contributes to stability by supporting the pelvic wall, pelvic bones, and it contributes to stability like when you're walking or when you're doing exercises. It helps to maintain the level of the pelvis and core control. Okay, and then sexual functioning, that's the 5th S. So these muscles wrap around the vaginal canal and they connect directly to the clitoris. So they directly affect orgasm, arousal, and just the contractions that you feel during intercourse, right? Or if you're using a toy or anything like that, it's going to affect arousal and orgasm because they're connecting directly to the clitoris and they're wrapping around the vaginal canal. So they contract when you have an orgasm. And that is like all these muscles, all these layers that we're talking about, they all contract at the same time. So even when you have like an orgasm, they're going to contract all at the same time. It's not just one muscle contracting or a muscle just connecting to the clitoris that's contracting. All these muscles contract at the same time. Okay, next slide. Okay, so these are cancer-related sexual issues. Okay, so you have changes in hormones. The different cancer treatments can affect those levels of hormones, right? So you can experience dryness. So this can affect lubrication, obviously, in the vaginal canal and in the vulva, in the external female genitalia. So dryness can affect the pliability of the tissue and make intercourse really painful, whether you're with a partner or you're using manual stimulation or if you're using a toy. It's gonna, it may feel painful. It may feel like the tissue is really stretching a lot because it's so dry. Okay, pain. Pain can be from a number of issues. There are different areas where you can feel pain during intercourse or during intimate play. So you can have pain in the external female genitalia, which is the vulva. That's the labia on the outside, the labia majora, the labia minora, the area inside the labia minora. That's called a vestibule. That can be painful for certain reasons. It could be from like an allergy. It can be from, hormonal changes, again, affecting like irritation and sensitivity in that tissue in the external female genitalia. You can have, you can be allergic to your partner. You can have different pH. You can have different bacteria levels between you and your partner, and that can make you reactive and hypersensitive in the area. There could be a neuralgia, a hypersensitivity of a nerve that can make any kind of contact with anything. If again, like if you're using manual stimulation or you're using a toy or you're with a partner, just like contact can be really irritating. So that is one place that you can feel pain during intercourse. Also, you can have pain along the vaginal canal, and that can be from fluctuating levels of hormones. It could be from the treatment, that it can affect the pliability of the vaginal canal and the tissue in the vaginal canal. So it could feel like it's stretching a lot, like it's ripping almost, and that's called vaginismus, this tightening of the vaginal tissue, and that can be affected again by cancer treatments. And so also remember, the muscles are wrapping around. So the muscles are also wrapping around the vaginal canal. If the muscles are tight, then you can also have that sensation, that like super tight ripping sensation during penetration, during intercourse, because the muscles are wrapping around the vaginal canal, and it can be very uncomfortable along the vaginal canal like opening. Okay, the other type of pain with intercourse is like a deep abdominal ache, and that's with deep penetration. And that can be from reflexive spasming of the deep pelvic muscles. So it can just feel like, a deep ache in the abdomen. And that's from the muscles reflexively spasming, and that's from like, not connecting. I'll talk about how we would treat these things. But it's from like not connecting with the muscles, and the muscles kind of spasming on their own. But as a way to connect with them and try to relax them. So there's pain with intercourse is called dyspareunia. So, whenever patients come in and they say, I have pain with intercourse, I say, is it on the outside? Is it along the vaginal canal? Is it a deep ache in the abdomen? Does it feel like your skin is irritated? Does it feel like a burning? Does it feel like, radiating pain to your clitoris? That could be a neuralgia. There's different ways that intercourse can be painful, and it can be affected by cancer treatment. So also there could be adhesions, like if people have tumor removed or some kind of growth in the pelvis removed, there can be scar tissue, and you could have adhesion of the tissue that could feel like a pulling or like a stabbing during intercourse in like one particular area. It can be like a focal tenderness, and I'll show you different tools that we use to treat all these different things. There could be fibrosis, which is like a thickening of the tissue. You can have issues with fatigue from the cancer treatment. So that's an issue with my cancer patients as well as my MS patients, is like fatigue during intercourse and trying to build endurance or accommodate for the fatigue. And I'll show you a way that we accommodate for the fatigue. Atrophy is, weakening of the tissue, thinning of the tissue, also from hormonal changes from cancer treatments. Scar tissue could be a procedure to remove remove a tumor or growth, or it could be from like radiation and chemo can cause scar tissue. Nerve injury, again, from either procedure or from cancer treatments. It can affect sensation. Maybe if somebody had treatment on one side of the pelvis, maybe they have just less sensation on one side, and that can affect orgasm and arousal. Weakness of the tissue. If you've had procedures or treatment, it can affect the range of the hips, which can affect sexual positioning, and it can affect mobility just in general, but also during intercourse, during sexual activity. So go ahead to the next slide. So this is a sexual response cycle. And these, this is not set in stone. There's no like time protocol that is standard for everybody. And it doesn't even mean that like one partner's sexual response cycle will match their partner's sexual response cycle. Women and men have different stages of time at each of these parts of the cycle. So there's desire, there's excitement, there's a plateau, and there's an orgasm, right? And then resolution during sexual activity. So for females, because it's like oncology treatment actually affects males differently with the sexual response cycle, but for females, you can have decreased excitement phase. There could be an extended plateau because of cancer treatments. There can be a more of a need, like a higher threshold for stimulation for orgasm. And there can be a depressed and elongated phase for any of these parts of the cycle. So again, cancer treatments could affect all parts of the sexual response cycle, and it can make it frustrating for patients, and it can change how they respond to their partner and how their partner responds to them. Okay, next slide. So what can we do about it? So I'm going to talk about the different treatments that we do in physical therapy or in pelvic physical therapy for sexual dysfunction and for just like tight pelvic floor muscles. Okay, so strengthening, stretching. I'm actually just going to go through these in the next slide. So can you go to the next slide? Sorry. Okay, so I wanted to show you some of the tools that we use. So if fatigue is an issue, then there are these positional wedges that patients have been actually asking for. The one on the left is called the Liberator, and you can move that top wedge to be in different positions. So it just helps them maintain position with their partner for them. And it helps with, like I said, fatigue if you don't have to hold yourself up. And it helps with maybe also getting a certain angle of penetration with these positional wedges. So that one on the left is called the Liberator. I mean, it can be a regular wedge that you use or cushioning, but this is what I order for my cancer patients who have issues with fatigue during intercourse. On the right, that's something called the O-nut. And this is for my patients who have pain with penetration. So these are stackable like silicone rings, and it's a buffer basically. So it's supposed to be worn by the penetrating partner, and so that the penetrating partner doesn't penetrate too deeply if the female receiving partner is having pain with penetration. So the more that they can tolerate, then they remove a ring, because these are like stackable silicone rings. So then they would be able to penetrate deeper, and then when they can tolerate more penetration, they would remove another ring so they could penetrate deeper. So it's basically like a buffer. So it's called the O-nut. So it customizes penetration depth. Go ahead to the next slide. These are pelvic wands. So let's say someone is feeling pain with a trigger point on the inside of the pelvis. So if you're having a lot of tight tissue, if you're having if there are adhesions from scar tissue from cancer treatment or something like that, and you just can't get to it on the inside, like it's not like, if you have pain in your shoulder and you just want to work out a knot and you put pressure here and it releases, you can't get to the spaces on the inside of the pelvis, right? So we use tools to get to these places. And these are wands that can be used in different ways. So it's nice that it has a curve because it gives you a little bit better mechanical leverage. I'll show you another one in like a different slide where it's straight, and it kind of fatigues the patient because they have to hold it at this weird angle because it's not flexible. So since this has a nice curve to it, it gives you better mechanical leverage so you can get to certain areas in the vaginal canal to work on the trigger points of the muscles wrapping around and the tissue wrapping around the vaginal canal. So all these colors, each one does a different thing. They were developed by a PT, a pelvic PT, and the purple one is regular. It doesn't do anything. The yellow one, it holds temperature, and you can put it under the faucet for like a minute or two, and it'll hold that temperature for about 10 minutes. So sometimes patients feel really irritated in the vaginal canal, and they need just kind of soothing, So sometimes patients want something that is cooler, and so if they put it under the cold water and insert it, it soothes like the irritated tissue on the inside of the vaginal canal. If they want something that's just warm and they feel like that would be more soothing to have like a warm sensation on the inside to relax the tissue, they could hold it under the warm water. It holds the temperature for about 10 minutes. They recommended not soaking the whole thing in hot water, but just like holding it under the faucet for about 1 to 2 minutes. The teal one, it vibrates. So some patients who have had cancer treatment, they lose sensation in the area. And so what we recommend is some kind of like some type of vibration, something to stimulate the nerves and the receptors in the wall of the vaginal canal. So that one vibrates a little bit. I think it has a few different settings for vibration levels. And uh, yeah, so I think the teal one does that. I don't know what the blue one does, but there's an orange one. I forgot to put the picture here. The orange one is actually like bendable, so you can flex it in different positions to maybe help you get a certain area easier. So if you wanted to use it, you could even use both sides because one side is a little pointier, one side is thinner. So what they recommend is the thinner side to use in the rectum if you had like rectal trigger points or tight tissue or adhesions like around the rectal canal, and use the pointy part that's a little thicker, but then it goes to a point in the vaginal canal. And what you would do is like I have patients just kind of like use it to explore, right? So they don't know sometimes that like putting pressure from the inside is a way that they can access a tight spot or like a trigger point or something like that. So I'll have them use it. I have them put pressure in the vaginal canal, like in the points of a plus sign. So again, if you're looking at it like a clock, I would say, okay, let's put a little pressure using the tip with lubricant towards the top, like to 12 o'clock. Hold that for 30 seconds. How does that feel? Okay, let's push down to 6 o'clock. How does that feel? 30 seconds. And then we'll go to 3 or 9 o'clock and we hold the pressure on that point for 30 seconds. If they don't feel anything, we go a quarter of the way into the vaginal canal. If they access a point that is really tender, I say, okay, hold the pressure there for 90 seconds. Because if you hold pressure for 90 seconds, then the knot or the trigger point will release, right? So it's the same thing like if you're trying to work a knot in your shoulder, you hold it down. If you hold it down for 90 seconds, trigger point should release. So it's the same thing. You would use a tool though to access the trigger point on the inside of the pelvis. So sometimes patients say like, oh, when I go up to 12 o'clock, it feels really burning. Like there's like a radiating pain to my clitoris. There's a branch of a nerve there and it could be irritated. You could have a neuralgia. So we use this tool to work the tissue around that nerve to relieve compression. These are things you can buy on Amazon. These are like $40 or something like that, I think, or like $30. So these are tools that you can use to stretch the vaginal tissue and work on trigger points from the inside. So these are available to you. You don't have to get special order or anything. They're on Amazon. It's called Pelvic ones. Okay, next slide. All right, these are other versions. So the one on the right, these are a set of dilators. So the gray part is like a handle that clips to the underside of any of those white like canister looking things, right? So the one all the way, the white dilator all the way to the left is pretty small. It's like the size of a finger. If you can tolerate like a manual exam from your GYN, then you can tolerate that first one. It comes with lubricant, and basically you would use it to, again, stretch the vaginal tissue. You would use it the same way as the pelvic wand. It helps to stretch the vaginal tissue because there's different sizes. So when patients can tolerate the first one, they go through the plus signs, the points on the clock, like the 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock. If they can go through all those points throughout the vaginal canal, all the way to the deep end of the vaginal canal, then I'll switch them to the bigger one. So we start stretching the vaginal tissue if vaginal tightness and atrophy is an issue, and which can be an issue with cancer treatment, right? So every time we go through one of the dilators, we switch to the bigger dilator to stretch the vaginal tissue. The device on the left is called the Milli, and this is something that you don't have to switch out all the parts. You just insert it. When it starts off, it's like, again, the size of a finger. But then there's two buttons. It's a plus sign and a minus sign, and there's a digital readout. And so if you press the plus sign, it starts to expand. So you don't have to switch out the parts, which is nice because it's in there, and then you're controlling how much of a stretch of your vaginal tissue that you're getting. This one's more expensive. This one's like $300 something. The dilators on the right, they're like $40 on Amazon. They're just called a dilator set. Pelvic wands, again, they're just like about $40-$50. But the Milli is a nice option because you can just kind of leave it in there and you're controlling it with that button. going about like 1 millimeter each time you press the button, and it goes up to 25, 0 to 25. So it just slightly expands. It doesn't expand to be a cylinder still. It's because there's like these metal spines on the inside. So that's the only weird thing about the milli is it ends up looking like the Washington Monument at the end. So it's like, it's kind of got like points to it, which is ridiculous. I've talked to the company. I'm like, you need to redesign this. It doesn't seem to bother patients, but because it's soft silicone material, but patients like it because they can just kind of leave it there and slowly increase the width and the diameter of it. Okay, next slide. All right, so these are devices called Biofeedback. So one on the left is well, the one on the right is called weights, but the one on the left is Biofeedback. So there's a little white sensor, and that I would have patients insert that. It has little metal plates on it, and that picks up the electrical activity of the muscle. And then it connects to a unit, and that unit, that box that's there, it's very simple. Like, this is like a home trainer. Like, patients could use this at home. It's very, very simple, and it is like very basic biofeedback. Basically, the more you squeeze on the sensor, it's picking up the electrical activity of the muscle, and then it's displaying it in lights and beeps on this unit. Again, very simple. So it's something that can give you like visual and auditory feedback of like if you're squeezing your muscles or if you're relaxing your muscles. So if you're squeezing your muscles too much, there's a lot of tension in your muscles, then the lights are going to go all the way to the top and it's just going to stay there. And that's not what you want either. You want to have control so that you're squeezing your muscles and you're relaxing your muscles when you need to. Okay, so but how I use it and how pelvic physical therapists use this is that this unit can also connect to software, so you can see on a computer screen like what your muscles are doing. There's like games and silly things you could do on the screen, and we can use it to help you see if you're contracting at all, if you're contracting the right muscles, if you're squeezing squeezing too much, if you're squeezing muscles that you shouldn't be squeezing, or if you are like not squeezing at all and you can't find the muscle. So it gives us a lot of information visually, a lot of objective measurements too, which is really good. I like biofeedback. I use it with every patient. The one on the right, these are vaginal weights. They're like little weighted tampons. Basically, all of those little colors, they are different increments of weight. So a way that we help patients find their pelvic floor muscles is to use the weights. So they use one at a time. They insert it just like they would a tampon. The string would hang out. And then just because there's a weight in there, it helps to stimulate there's receptors in the wall of the muscle. So it wakes the muscle up. It helps you build awareness. It helps build that connection from your brain to the pelvic floor muscles. It helps you find the muscles. If I just tell you to squeeze, you're most likely going to squeeze the wrong muscles. You're most likely going to squeeze your butt muscles or your thigh muscles or your stomach muscles, or you're going to hold your breath. This at least gives you some kind of cue because you want to hold this in and you don't want it to fall out. So it's going to give you a cue about like where the muscles are, right? Because if you're not contracting around this, it's going to fall out and you don't want it to fall out. So you can imagine that it's like urine and you're trying to keep urine in. And so you would squeeze, and having something to squeeze around is always better than saying just squeeze, because you're most likely going to use the wrong muscles. If you're using these weights, you have to use the right muscles to keep it in. So with this, I help patients do exercises with them because you cue the muscles to reflexively kick in. Remember, if you're coughing, laughing, and sneezing and your muscles aren't kicking in, then they forgot what they were supposed to do. So working with weights would help strengthen the muscles and help remind them what they're supposed to do. So we would use this to during exercises, during standing exercises, maybe you lose urine a little bit, like when you lift something from the floor or when you change positions. So we would have the weights in and you would be able to, do that movement, but try to remind the muscles to squeeze so that you're not leaking urine when you do those motions. Okay, next slide. There are those weights, you can get them on Amazon also, like $40, and you can practice exercises. It comes with a little booklet and it can help you with exercise. You can find exercises online as well. These are home units. They're fantastic. These are things you can get online. The one on the left is called the LV. The one on the right is called the Parafit. They wirelessly connect to your phone and you just download an app. I have it with the patients here, and I set it up with them like during a session. It's very quick, and it the green one on the left, you insert like the bulb part, the little tail sticks out, and it just kind of like rests on your body. And so you would squeeze it with your muscles, and it tells you on the screen if you're contracting correctly. It's such a great device, because some devices, they just tell you like how much you're contracting, but you could be contracting the wrong muscles. This, because of the sensors on the inside, it'll tell you if you're contracting properly, because you always want to pull up and in, right, and not bear down and out. You always want to pull up and in when you're squeezing your pelvic floor muscles. So this thing on the left, it will like give you cues on how to squeeze. It will give you a program, and then it gives you exercises. So it's like it'll have you try to hit targets and keep the ball like above a line or something like that. And it's very visual, and then gives you a lot of feedback about how you did. And then based on like your first performance, it creates like weekly goals and like a weekly program for you to do. And patients do this at home. It's fantastic, and they really see results. So you wouldn't plug in the green device, you would plug in that pod. See the pod in the back that it's like cylindrical? Like that's what you plug in, and you would place the device inside the pod, and that's what is you charge up. So this one online, it's like, I think it's like 175 or something like that. I think it's really, really, really worth it, because I think the feedback it gives is priceless. The one on the right is the Parafit, very similar. It also, you know, wirelessly connects to your phone. It gives you a lot of information about how to squeeze, and shows you on graphs, and gives you like programs of what to do. I believe you don't have to charge this one up. It has this like long lasting battery in it, and so they assume by the time battery dies that you've you know fixed your muscles and stuff like that. But the one on the left is really nice. Next slide. This is a new one that came out, and they've been really pushing this in my hospital system, in the VA hospital. And it's something called the Flight, and it's also something that you would insert. And the cylindrical thing on the left is something you would insert, and then it connects to that like round device on the right side. And they've just released an app. They finally developed an app for this, and what it uses is mechanotherapy to help you find the muscles and train the muscles. So the device on the left, it will vibrate a little bit. So it's kind of wide. So they say there's like a pre-stretch to the muscles that help wake up the muscles and the tissue. And then it gives you a program. It'll say like squeeze, and it vibrates. So you squeeze as it's vibrating, and there are these little lights on the device on the right side that go up that tell you like how hard you're squeezing. It also now connects to your phone and tells you like how much you're squeezing. And supposedly they're doing all these studies to show that this really helps with waking up the muscles, to cure stress incontinence if you're leaking when you cough, laugh, or sneeze. And doing this 5 minutes a day for like 6 weeks supposedly like cures any problems you're having with incontinence. So I haven't had patients use it long enough and consistently enough to see like the full results, but it's been getting good reviews. So it's another way to treat the pelvic floor muscles, to find the pelvic floor muscles and to train them. Okay, next slide. So, in terms of intimate activity when you're undergoing treatment, when you've had treatment, you know, communication is really important with your partner. Obviously, if people are having trouble being intimate with their partner, oh, the flight is insanely expensive. Even the thing that I just showed you with the vibration, it is $1,600. I don't know why. Nothing is that expensive, and I argue with them all the time because they make it. It's 1,600, I think, for the VA hospital. I work in the VA hospital, and then it's like 1,700 for civilians. Usually, it's the opposite. Like, if something is way cheaper for civilians in the real world, and then they overcharge the government for things. But I don't know, they swear by it. They say it fixes incontinence, but they have an insane price tag on it. I think it is extremely extremely expensive, and they're still developing it. But I can obviously just order it from my patients here, but I don't know. I don't have enough information to say that it's like 100%, it's 100% cure for incontinence, because I haven't had anybody use it consistently the way they direct it. But I don't know, I think it's super expensive. I think the other things are way more affordable and effective. So, these are just options I wanted to show you. So there's something called Sensate Focus. It's like a program basically that you would do like with your partner, or you could do it even unpartnered. If you have not had intimate relations, if you have not had intercourse, or you feel really uncomfortable with your body. And so it's a program where you would do different things to be in touch with your body and connect with your body again, with the goal of being intimate and having intercourse. But it's a like I always start with patients unpartnered first, so they start to feel comfortable with their bodies again. And like the first week we talk about like just like touching your skin and how does that feel, and being really mindful about that, and journaling about how it feels to like connect with your body again, not touching any erogenous zones, and not with the goal of having an orgasm like the first week or two or three or four. And the next week we talk about like, okay, let's you take a shower and like focus on how the temperature of the water feels on your body. How does the drops of water feel on your body? How does the water falling down your body feel, and how does that make you feel? Does that trigger anything? And then I have the patients like journal about how that feels. And then we'll practice like putting on lotion, and like how does that feel? And it's all about like connecting with the body again. And then we move towards like touching yourself, maybe like through your clothing, maybe touching erogenous zones, and being aware about how that feels. And then after that, then looking at yourself in a mirror without any clothes on, how does that make you feel? And, journaling about your feelings and stuff like that, and working through things that may be obstacles to intimacy. And then moving forward with either using like with masturbation, or using a toy or something like that to get back to being intimate, and, with the goal of being intimate and having an orgasm, but like being aware of how you're feeling about that, either unpartnered, or you would do this with a partner. So it would be like homework that I would give the patient. That's called a Sensate Focus program. Other things is like, just being, if you're really self-conscious of any scars or anything that you've undergone in terms of cancer treatment, like there's different lingerie that caters to this. There's different coverings for like stomas. If that's the kind of treatment you've had, talking with your partner about where is okay to touch. They have these self-body mapping diagrams where you can like communicate with the partner before you're intimate and say like, I feel comfortable with you touching me here, I don't feel comfortable with you touching me here, so that you're setting boundaries and standards before you engage in intimate relations. Being mindful and not judging, and really being present and in the moment during intimate relations with your partner. Sensate Focus we just talked about. And then there's different like positions that you can do that can maybe protect, if you're having pain with intercourse, if you're having pain with contact in certain positions, like doing different positions like spooning might help, because the glutes can act as a buffer. Okay, next slide. Right, so these are some stretches that I give patients. I love these stretches. These are yoga poses. They're big pelvic and hip openers. And these look really hard, but there are ways to modify it. The one on the left is called the pigeon pose. The one on the right is called lizard pose. It looks really tough, like I said, but there are ways to modify this. And it really helps to stretch the pelvic floor muscles. It helps with like the flexibility and the mobility of the pelvic bones and the ligaments in the pelvis, to try to open it up after you've had oncology treatment. There can be a lot of, like I said before, like decrease in mobility, increase in atrophy, decrease in flexibility. So making sure that you're doing stretches to open up the hips and the pelvis is really important. Next slide. This is the one on the left is called the happy baby stretch. And, for these, you don't really need equipment. You can do these in bed in the morning before you get up, holding on to if you can't reach your feet, you can grab onto your ankles, grab onto your pant legs, put your feet together. Just pulling your feet up toward your chest can help just open up the hips and the pelvis. You could do it with one leg at a time, like the picture on the right, which is the half happy baby stretch. Just helps to open up the hips and the pelvis. Next slide. These are some books about like sexual function, sexual encounters, sexual like breaks and accelerators. So there's this really great psychologist, sex therapist called Emily Nagoski, and her book's called like Come As You Are, Come As You Are. And so she talks about like breaks and accelerators and like things that are obstacles to intimacy. She calls them breaks, and things that facilitate intimacy, she calls them accelerators. So she goes over, how to eliminate the breaks and to increase the facilitators and the accelerators to intimacy. Better Sex Through Mindfulness by Lori Brado. She has like she's a workbook that comes with this, and it's really great for just, different exercises and tools to be present in the moment and really focus on, sensations and communicating about your emotions and your feelings and your triggers and all that stuff through intimate relations. Magnificent Sex is a book that has stories from all different couples and all different ages, sizes, and shapes of couples, and includes LGBTQIA community and like all different ages, and everyone just talking about what they feel makes magnificent sex and what their experience has been. So it's really nice, bunch of stories from different people. And the other two, they're just about function and the psychology behind intimacy and sexual function and dysfunction. Okay, you can go to the next slide. All right, so we're going to practice a little bit. And I just want you to practice finding your pelvic floor muscles. So you're just going to sit, and you're going to sit up nice and tall. And I want you to just try to find those muscles. Remember, what you feel like you might do instead is squeezing your butt muscles. So I want you to think about relaxing your butt muscles, relax your stomach muscles, relax your thigh muscles. Because what do we do when we have to go to the bathroom? We squeeze our thighs together, right? So I want you to think about relaxing your thigh muscles and keep breathing. So think about you just had like a lot of water, or you had a lot of coffee or soda or whatever it is, and the bathroom is really far at the end of the hallway and you have to hold it. So I want you to just close your eyes and just imagine that you're trying to keep all those outside muscles relaxed, and you're trying to hold in urine by squeezing inside muscles. And I want you to focus on squeezing up and in. And people, they tend to sometimes not have the best awareness, and they push down and out. And I don't want you to push down and out. I don't want you to force any release of the contraction. You're just going to relax after you've squeezed. So think about squeezing up and in, and you're going to hold it. Keep breathing, hold it for 3 seconds, and then just release. And you're going to release for 5 seconds. We're going to do this 5 times. Okay, squeeze up and in. Think about the inside muscles. Keep breathing, and relax. 5 seconds, relax, just releasing the contraction. Squeeze up and in. Hold it for 3 seconds. Relax the thighs, the butt, the stomach, and relax. 2 more times. Squeeze up and in. Okay, and relax. And then squeeze up and in one more time. Good, and relax. So there's different fibers in the pelvic floor. There's in the muscle, there's fibers that kick in when you cough, laugh, or sneeze, and there's fibers that kick in when you're on a long bus ride or train ride. So the quick flicks is the exercises you want to do if you're trying to train the muscle fibers that kick in when you cough, laugh, or sneeze, because they're quick recruitment fibers. So we're gonna practice now, and you're just holding it for 1 second. Super simple. So you're just gonna squeeze, relax, squeeze, relax, squeeze, relax. So we can do that 10 times. Okay. So when I count, then you're gonna squeeze. Okay. So squeeze 1, relax. 2, squeeze, relax. 3, 4, 5, squeeze, rest. 6, 7, squeeze. 8, 9, and 10. Excellent. Okay, so some people, they hold their tension in their pelvis. So some people hold their tension in their shoulders, and they wear their shoulders as earrings. And some people hold their tension in their pelvis and they don't even realize it. And it can just be where they naturally tend to tense up. or they could have had like an injury there, and that's just where they tend to guard. So for now, I just wanted you to focus on breathing, and we're going to do a diaphragmatic breathing exercise, which is very simple.
I'm
And
so sorry to interrupt you, but I also want you to be aware that there have been a bunch of questions.
yeah, this is the last thing,
Okay, I
and then
just
I'm
want
going
you
to
to
take
know
all the
because I think
questions.
people have a lot of questions, which is great.
Yeah. This is the last thing to exercise, and we're just going to practice for 1 minute and then 10 minutes for questions. Okay, so you're going to put one hand on your chest, and you're going to put one hand on your low belly. Okay, and I want you to breathe in. You're going to breathe in through your nose, and the top hand is not going to move. Okay, so we always focus on breathing, like taking a big deep breath from our lungs, and these are postural muscles, right? They're working to keep your head up and move your head and move your torso, but they're not really meant for breathing. And the breathing is meant to happen at your like low abdomen, right? Because the diaphragm is this muscle from that's like a dome shaped muscle underneath the lungs and tucked up under the ribs, and it moves up and down to move the air up and out. Okay, so I want you to think about the bottom hand moving when you breathe. So when you breathe in, bottom hand moves out, top hand stays quiet the whole time. When you breathe out, bottom hand moves in towards the spine, right? So you're emptying your abdomen from air with air. So we're just going to do this for a minute. And I want you to think about when you breathe in, try to count to 4 in your head. And as you breathe out, try to count to 4 as you exhale. And we're just going to do that for a minute. And I'm just going to time it. And I want you to think about breathing deep, like deep into your belly, deep into your abdomen. Oops. There we go. So you're breathing in, bottom hand moves out, count to 4 in your head. You breathe out, 1, 2, 3, 4. The belly and the bottom hand collapse towards the spine. Okay. And when you think about breathing in, good air, it goes all the way down into your pelvis. When you breathe out, all the tension that you're holding in your pelvis, it comes out, and you're breathing it out of your body. You're releasing all of that tension. So just be aware if like maybe you're holding in tension from the day, from the morning, if you had some stressful encounter, or if you had some stressful thoughts, maybe you're harboring it in your pelvis. And I want you to think about breathing all of that out. Do your long exhale. 10 more seconds. Okay. All right. Very good. So there's some things you could practice, trying to find your pelvic floor muscles and trying to relax your pelvic floor muscles.